Therapeutic communication. In this session, we will discuss the development of therapeutic communication. The objective for this session, we'll discuss the concept of therapeutic communication. The second objective, we have to describe the characteristic of client-centered communication. The third objective, apply the concept of client-centered communication. Then the fourth one, discuss active listening responses used in therapeutic communication. The fifth one, discuss the use of verbal responses as a communication strategies. And the last objective, it is describe other form of communication used in nurse-client relationship. Therapeutic communication, if we go through the historical background of therapeutic communication, it is firstly coined or formed by the Jürgen Roch in 1961, and it refers to the interactive dynamic process entered into by the nurse and the client for the purpose of achieving identified health-related goals. So therapeutic communication, it means it is for the purpose of the healthy or identifying and achieving the health goal of our client. By the way, it has to be used not by the nurses, it is by all health professionals, but here we are concentrating on nursing. In a therapeutic communication, it can be used by all health professions. The characteristic of therapeutic communication, it has to have all of those concepts. It has to have role and boundaries for that communication. So it has to have the identified roles and objective and boundaries for that communication. It has to be individualized strategies for each client. We will have an individualized strategies to deal with him. It is also a goal directed, and it is directed toward therapy and treatment. It is also client concern, so it has to be within the client concern. The purpose of therapeutic communication, we have through the therapeutic communication to cover those purposes: establishing therapeutic provider client relationship, identify client concern and problems. So through communication with our client, we are identifying his problems and concern in order to solve those problems and concern. Assist the client perception of the problem. We have to discover it from according to the perception of the client himself. Recognize a client need and guide the client toward a satisfying and socially accepted solution. So the end result, it has to be to guide our client or our patient toward a satisfying solution, or a solution that satisfy him, and it has to be that solution, it has to be socially accepted. Essential component of communication. As any communication, it has to have there is the component of it. It is from composed from sender and message and channel of communication and a receiver. So it is also both side. So from the sender will be changed to a receiver, and in order to get the feedback. So, and if we are looking at that component of the therapeutic communication, one, in each one, in the sender, there is also factors that interfere with his message and with his communication. So the message that he is sending, it is come out from his cultural norm, thinking process, and emotion. So those concepts, it will come out as a words and a message and body language. He has to use also his body, his eye contact. The receiver also, he is having his own norms of analysis of the message. He is having his own emotion. He is having his own listening skill that will, by that, he will get the message and analyze it. In the process of communication, also we have to have the personal space and also the overt and covert message. So those are the essential component of the message. So the message, there will be in communication, there will be a sender, there will be a receiver. The or each of them will, or the sender will choose the message, think of what context of word and verb that he will be using to send that message. Then the receiver will conceptualize that message, try to understand it, then give a feedback to the sender. So this is the component, simply the component of the communication. So it is a two-way communication process. There are barriers that interfere with effective communication. So the barriers of effective communication, when the client has one of the following. So the barrier, it can be from the side of the client. One of those barrier, which is the pain and physical discomfort. So if the client is having pain or a physical discomfort, or if anyone is having pain and a physical discomfort, in this case, his ability to receive the message, it will be different, and his ability and also the capability to analyze that message, it might be affected. Unable to understand language and terminology. So the other factor or barrier, if there is a difference between the sender and the receiver in the language, in the spoken language that they are using. Even in the same language, if the sender is using a different terminology, like medical terms, which is not used by usual people. Also, if there is a strong emotion, it will seal the way of transfer of the message. So he will not be able to understand the message properly. Feeling defensive or insecure if the client is, if anyone is feeling unsafe and insecure, in this case, the ability to understand and conceptualize the message, it will be affected. He will not be able to understand it in the proper way. Confused. Confused. Here, the client, if he is confused, either due to the disease process itself, like in case of fever, in case of impaired consciousness state, this will interfere with conceptualization of the message and understanding the message. Also, if the client is taking some medication like strong analgesic, narcotics, post-operative after taking narcotics or anesthesia, all of those conditions, it will lead to confusion and interference with the effective communication. It will be as a barrier of communication. Deprived of privacy. So when, especially when you are going to the hospitals, most of the hospital wards or rooms, they are having 6 patients in it. So in this case, if you are going to assist a client or communicate with a client with and discuss some private thing, discuss his illness, discuss his history, and he is feeling that everyone can listen to what he is talking. In this case, also, this will be as a barrier for communication. So try always to have a privacy and consider the privacy of the client. You can take him to uh, private to treatment room or to any room that it has its privacy. Cognitive effect also, or to cognitive deficit. If the client is having a problem with understanding, if he is having if the ability of recognition or understanding is low, also this will affect the message. Barriers for effective communication when the nurse is not fully engaged with the client. So this is from the nurse side. When the nurse is preoccupied with a personal agendas, so she or then he is having his uh, own personal agenda, and he is trying to uh, do that or to perform that and not looking or concentrating on the client himself. If the nurse also being in a hurry, she is having many work to do, or many client that she is assigned to look after them. In this case, she is not having an enough time to discuss with the patient, and in this case, it is a barrier for communication, and she will not be able to understand him properly. If you, the nurse is trying to make assumption by herself that it might not be what the client meant. If you are, as a nurse, becoming defensive, also this will interfere with the process of communication. Thinking ahead of a next question. In this case, your mind is having to think at the same time, dealing with the question, the first question, and dealing or preparing for the second question. In this case, also, it will interfere with the process of communication and giving the message and understanding the message. If the client is emotionally aggressive, in this case also it will affect the nurse and the client Self-awareness, therapeutic use of self. In self-awareness, the purpose of developing and understanding own values, belief through feeling, attitude, and motivation, and prejudice, strength, and limitation, and how the qualities affect others. So, understanding yourself, it will help you in the communication process. So, the nurse should understand her beliefs and values, and also the beliefs and values of others, and her feeling and her attitudes, so she or he should be aware of what is going in and every minute attitude and motivation and prejudices which is there, in order to have a good relationship and a good communication with others. Also, therapeutic use of self, the nurse beginning to use aspects of his or her personality and also her experience and her values and feeling and intelligence in coping skills and perception to enhance relationship with others. So by that, it will be helpful for her or him to understand and communicate. Physical behaviors cues, we have the implements. Implements is a gesture or a body motion like handshaking, sign language. All of this should be understood by the nurse and by the health team when they are communicating with their client, and understand the meaning of all those gestures. Illustration, action which accompany and simplify the meaning of verbal communication, like smiling when you are talking about when you are talking about something and you are smiling, it will give an open face, and it might enhance the client to understand what is there and understand their feeling. But also the smile, it should be convenient with the context of the communication. Affect display. So also the facial expression of emotional affect, it will the alter expression also, it will be helpful in the explanation of the message. So it should be convenient with the message that you are sending. And also uses of regulator, which is non-verbal communication, adjust of communication. Physical barriers cue, adapter, uh, repetitive non-verbal action like foot tapping. Also, this might interfere with the communication process. Physical characteristic, appearance of the person, also height, body shape, body build, and order. All of those, it will has an interference, and it will affect the communication. Client concerned communication, or client centered communication, sorry. So client centered communication, in client we are view as equal important. So the client, all client has to be viewed as equally important informational resources and collaboration in healthcare. So they are giving us an important information about themselves, and by that we will be using those information in their care. And also client want to be listened to. So everyone who is having problem, and here the client, he is having his illness and his complaint, so he is in need for someone to listen for him and involve in also has to be involved in their own care and choosing the plan of treatment and the plan of care. We have to foster healing relationship between the health team and the client. Exchanging of information should be there. So we have to inform them all about his case and any new thing in his case and in the plan, and also be to discuss with him that plan, responding to his emotion, and also let the client to make his own decision. So we have to explain for him properly all the concept and aspect of the care, and he has the right to choose and to plan. Self-management. He should not lose his self, feel that he is losing his own self-management. So he has to feel that still he can control what is going on. What is the nursing? What the nurse listen for, or the team? In There is a guide for effective verbal expression in the nursing client relationship. Always, when you are communicating with your client, you have to define unfamiliar term that you are using, and act and concept also. We have to match content and delivery with each client, development and educational level, experiential frame of reference, and learning readiness. Also, so any context that we are dealing with the client, when it is delivered, it has to match his developmental stage, educational level. Also, we have to keep message clear and concrete. Mean here concrete that it has one meaning. It cannot be understood in another meaning. We have to be honest also in giving our message. This message, it has to be honest and simple to understand. Put idea in a logical sequence of related material. Also, relate a new idea to familiar one when presenting a new information. So we will tell him that this idea, and we will remind him, oh, that is, did you remember the previous idea that we gave you about so and so? So we have to give some similarity that he understand it before. Repeat the key idea in order to be sure that it is understood. Reinforce key idea also with vocal emphasize and pauses. We have to use the vocal emphasize, stressing on the idea which is important idea, and give pause or silent period to give the client time for understanding that idea. We have to use simple language as possible and use vocabulary familiar to the client. So we should not use medical terms. We should not use jargons or unfamiliar terms that the patient or the client is unable to understand them. Focused only in essential element, present one all and present only one idea at a time. So in order to have the client conceptualize what you are talking about, then you will shift to another idea after you complete the first idea. Use as many sensory communication channel as possible for the idea. In this case, we have to use all senses in this case. Meaning, so we can show him something while we are talking about that idea. Make sure that non-verbal behavior support the verbal messages also, and to be convenient with it. Seek feedback to validate accurate reception of the information. So you can ask the client if about the feedback in order to be sure that he understood the message. Communication patterns. Some clients want detailed information, while others they need the short, concise messages. So it depends upon the communication patterns of client and also the nurse. Some use also dramatic language in dealing with concept or understanding. So active listening responses. There should be minimal cue and leading and body action. So we have to use uh, like head nodding, leaning forward. This will give an impression about for the client that we are listening to him. Clarification. So if the client is talking to you and there is something that you it might give two meaning, so you can could you describe what's happened sorry when the client is talking about something and you feel that there is you need some information more about that, so you can ask him, could you describe what's happened in sequence after that. Restatement. By that, we are, in order to confirm the meaning that the client want to give, by asking, are you saying that so and so? Paraphrasing also, by rephrasing the statement, reflection on what we are doing or what the message. Summarizing. At the end, we have to summarize what we were talking about. What we were talking about. Silence. Give a period of silence to understand and to give the chance for the client to understand. Touch. For touch also, we have to use touch as therapeutic touch. We have to use touch according to the procedure that we are going to do. We have to be concerned about touch because touch has many meaning, and we have to understand the meaning of each touch, and it depends, and we have to be cautious when dealing with the client, especially from other sex. Negative listening response. From the negative listening response, if we are giving a false reassurance to the client, by that we are losing the client, and we will lose the track of communication. Guidance is giving advice also. So we have to avoid giving direct advice. We can explain to him the benefits and advantage and disadvantage of everything, then he has to choose. He has to have his own choice. Flash inference or making assumption. Also, it will affect the messages, or it will affect the communication style. Moralization. When we are trying to express our values and trying to make the client adopting our own values rather than his values. Value judgment also, like approval and disapproval. In this case also, it is negative listening responses, social responses. In interviewing and relationship skill, so with the interview, when there is any interview, there are phases, which is the phases of communication that that we discussed before. Also, it is similar to the phases of communication that we therapeutic communication that we discussed in the introductory unit. So the interview, it has the orientation phase. In the orientation phase, we have to get a rapport and structuring with the client. The purpose of that is to build working alliance. In this case, the nurse is in need for basic listening skills, attending information and giving information also. The second phase in the interview, which is assessment and engagement and beginning activities. So in that intervention phase, we are gathering information, defining the problem of the client, identifying the strength and weakness of the client. The purpose of it is to determine how the client view problem, to identify values, beliefs, strength, to resolve the problem also, and to promote health and well-being. The skills which is needed by the nurse: basic listening, attending open-ended question, verbal cues, and leads. Planning activities, determining outcome, what is need to happen, and to reduce the self-care demand, where does the client want to go. So, and the purpose of it to find out how the client would like to be, how would thing be in the problems were, so if the problem were solved, and after the care. In the skills here, attending and basic listening and influencing feedback. Then we will come to the implementation phase, or implementing activities. We have to explain alternative and options for each each skills, to work toward resolving of the client's self-care need. The skills which is needed here: influencing, feedback, balance with attending and listening behavior. Then the last thing, which is termination phase of the interview, which in this it includes the evaluation, so which is generalized and transfer of learning, generalization and transfer of learning. So we have to evaluate what did he grasp from that, and what is the changes, to enhance changes in through feeling and behavior, also to evaluate the effectiveness of change in modifying the self-care need. The skill needed here: influencing feedback and validation. What the nurse will listen so she will listen to content team, the communication patterns also, description in content, body language and vocalization, feeling and revealed in person voice. So the change of voice of the client, because it will reveal the feeling of that body movement and facial expression. All of those things, it has to be observed in order to understand and what the message. What is not being said as well as what is being said. So she has to understand also if the client is having some information and he is hiding it for a purpose, and she has to try to find out a way of getting that information, if it's especially that information if it is needed for his care but not a personal information and social information which is not related to his care. The client prefer personalize the representational system, auditory or visual or tactile. Uh, what did he prefer in the communication? Did he prefer auditory or listening or seeing something or tactile? So which sense he is using more in communicating? The nurse on inner responses also. The effect communication product in other involving with a client. So all of those has to be done. Verbal responses, matching responding, so should match client message in level of depth and meaning and language. So the verbal responses from the nurse, it should all match the client message and level of depth and meaning of language using an understandable language. So simple terms should be used and focusing in a same problem and same idea, presenting reality and not to give a false reassurance for the client, giving proper feedback and at the time asking for validation when it